I'm going to share my journey with you guys on how I went from this size to this size. I've always been open and honest on my platform. I'm going to tell you guys exactly what I did without holding anything back. Oh, she definitely had surgery. She's totally on Ozempic. But I want to make sure I point out something first. I was just as happy with myself here as I am here. This is really not a weight loss or a fitness journey. This is a self journey for me. This video may take a few minutes because this is a 5-year journey for me on how I've been able to completely change my lifestyle. More importantly, if I'm going to educate my patients on losing weight and how important it is for their spine, I have to set an example for them. I do want to point out that I am a physician, but I am not a medical weight loss doctor and I am not a dietitian. So please do not take this as medical advice. This is purely my journey. One thing that I do want to get on my soapbox about is that in medical school, they don't teach us a lot about nutrition. All the strategies that I've utilized has really been things that I have taught myself or under the guidance of my doctor. I have been overweight pretty much my entire life. Like many of you guys, I have struggled with ways of going on fad diets and off fad diets in hopes of losing weight fast, but it just doesn't work that way. All throughout high school, college, medical school, and residency, I relied on food to help alleviate any stressors in my life. This is a picture for me the day I graduated medical school. Food, for me, was an addiction, and how we train our healthcare professionals is really unhealthy. Right after I had my son Riley in 2015, I leaned over and picked him up and injured my back. I treat people for back pain every single day, and I became the patient. From 2016 to 2017, I lost 30 pounds by going on fad diets. Then, as life would have it, in 2017, I got pregnant again and had my daughter in 2018. I knew I wasn't going to have any more kids. I made an honest commitment to myself to change my life after I had her. I had 2 discs herniated in my lower back, and I also was on blood pressure medication. I consulted with my physician as well as a nutritionist, and I read 2 books that I found incredibly helpful for me to understand how our body processes food. This was back in 2018. I may be dating myself by talking about these 2 books, but the Obesity Code was incredibly helpful in me understanding the science of how our body uses nutrition. That book is very scientific to read. I also use this book, Delay Don't Deny, A Guide to Intermittent Fasting, and I found it a lot easier to comprehend and digest. I also started reading a lot about our gut microbiome and how we process inflammatory foods, and I utilized some of those strategies in changing my diet completely. If we fast, we allow our body to tap into energy sources that are stored and not continuously using the energy that we are actively consuming. And it also allows us to separate ourselves from this continuous cycle of eating on a particular schedule and just eating when we're hungry. I've been an athlete my entire life, so working out was already something that I was doing. Utilizing the strategies of intermittent fasting with the techniques that I learned in this book, understanding my gut microbiome and foods that were inflammatory to me in combination with healthy exercise, I was able to lose about 60 pounds. But despite losing that 60 pounds, I still had a lot of excess abdominal tissue. This is the natural body of a woman that struggled with her weight her entire life and has had 2 10-pound babies. I did have to have surgery to remove that tissue. In 2019, I did have a mommy makeover by one of my physicians who is now one of my good friends. This is a picture from 2017 to 2019 after I had my surgery. Honestly, my goal is not really weight loss, but it's about becoming fit and strong. And remember, that comes in all different sizes. When I say this has been a journey, it's been a journey. From 2019 to early 2023, I was kind of in a maintenance phase. I work out 5 to 7 days a week by using a combination of both cardio and strength training. And I do this under the guidance of my physical therapist when I have injuries that limit the activities that I can do. Here's a picture of me and my family in 2022. If you guys have followed me on this platform, in August of 2023, I was asked to perform in our community's Dancing for a Cause event. I went to my physician and asked her what her thoughts were on a GLP-1 medication. Under her guidance and recommendation, I took Mounjaro, which is one of the GLP-1 medications, for about 5 months, and I was able to lose an additional 30 pounds. And I want to point out that there is absolutely nothing wrong with taking these medications to help with weight loss. They are an excellent medication for anyone that's struggling with weight, as long as it's okay between you and your physician. This medication even further enhanced my ability to detect that food is an addiction. It does so many different things, but one of the things that it's really helped me with is understanding how addictive that I am to certain types of foods, because it completely takes that away. Oh, she's going to gain it all back when she stops. And I may still have to augment myself with it if I'm starting to have a slide. There should be no stigma associated with this. That is my long-winded health journey.